And even a neophyte esthetician, if they ask the right questions, can seem like a seasoned veteran.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how are things going? I've just been thinking, we've done the Learn Skin podcast for so many, I say months, maybe even years when I think back.
Years, my friend, years.
Yeah, it probably is years, right? And not once did we talk about how we extract comedones because we thought we had it in the bag. But
Yes.
It turns out maybe there's more to it.
Absolutely. Those annoying things mostly on the face that we know as blackheads and whiteheads. When I came on to getting to know dermatology, I was working in a dermatologist's office, and I thought for the life of me, that's exactly what dermatologists are doing. That's all I thought they were doing. I thought they were doing acne and doing these extractions, and lo and behold, turns out it's completely not true, obviously. And we have other exciting collaborators in the clinic and outside the clinic, the estheticians that work with us in tandem to address some of these issues, including comedones. So we thought today we'll dedicate the right amount of time for this problem that really, really annoys every patient I see and every person walking down the street. And for that, my friend, we need an expert. We need a real expert on this.
We do. And we have a master esthetician, licensed esthetician, Douglas Preston. And he's been in the field for 40 plus years, working as a professional. And he's also done a lot with acne treatment training. He's an author, a career mentor. So in many ways, a renaissance man within the field of aesthetics. And, not only that, he's an innovator. He's not only done a lot of writing, appeared in trade journals and magazines, but he's also the creator of the Preston Comedone extractor, which has a different design than what we've all been taught as the standard approach with comedone extractions, at least in residency. So, Douglas, we are really excited to have you on the podcast and getting us set straight on what's the best way to do this.
Well, it's delightful to be here, so thank you for the invitation.
Absolutely, Douglas. Welcome to the program. Really excited to dive into this topic because, as I mentioned in the introduction, I think this really bugs a lot of people. And
Hadar, are we going to be picking at it?
I think we will. My friend. And so a lot of people are suffering with this, walking around, really trying to figure this out. And what I find exciting about real innovation is people taking a common problem that we thought we have solved and then different a whole new spin on it. Or maybe even screwing a new head on it. And I wanted to ask you, how did it come about? I think it's been a while, but hopefully you can dig back into your memory and tell us, how did you come about to observe that there's a problem there? Because I think innovation is probably at the heart of all our guests. So how did it come about, Douglas?
Okay, well, thank you for that. What inspired this invention, if you will, was the fact that I was encountering clients, aesthetic clients, who had an interest in either removing open and closed comedones, which unless there's inflammation, I do not consider acne. It's more of an aesthetic issue. But also for those people who had active acne with inflammation in the follicles and, of course, actual lesions, pustules, and so forth. The question was, however, is in this type of acne that I'm addressing, which is what I call congestive acne. This is where you have a follicle that's congested with follicular and epithelial debris, and it has triggered an inflammation response in the skin, and therefore we've got a problem. If you are dealing with that as an esthetician, of course, there's different kinds of methods for removing it. You can use a loop, you can use swabs, you can wrap your fingertips and so forth. And then there's these various tools, which back in 1983, when I came up with this idea, are exactly the same ones we have today. They haven't evolved at all. And I was looking for something that would be fast, efficient, as comfortable as possible, but that would allow the highest volume of comedone removal per session as possible. Because when the client is reacting to these impactions, then the best way to control that is to get on the opposite side of the bacteria cycle. In other words, we can look at some inflamed follicles and so forth, and we see that that almost all of these impactions are going to lead to that sort of result. But if we can remove the comedones that have not gotten to that stage, then we've circumvented the problem. The question is, how do we get large volume of that out of the skin so the result we're looking for could be achieved? And that's what I was looking for with this tool.
Yeah, no, that's really cool because, as I said, it's so cool when someone just looks at a problem that seems common and like, okay, we got a solution, but you say, no, this is not good enough, and I'm going to do it. So what does it look like? I think most of us who are in the skincare business know the common way of extraction, which usually, as you mentioned, you gave a nice overview of these tools, but in general, traditional extractors have a round ring around the follicular opening, and this is where you kind of apply pressure. Now, yours is shaped completely differently. Can you give our listeners a bit of a visual on this?
Sure. Thank you. The Preston extractor at the what we call the working tip looks somewhat like a hook. It has a rigid edge to it. Now, by the way, this tool was originally adapted from a Miltex fenestrated lancet. And at the very beginning, I was refashioning those into this device. Now, of course, right, if you've ever handled one of those tools, they're razor sharp. And, it's a cutting tool. So what I did with it is I dulled the sides of the blade so that it wouldn't cut, but it would bite. Because the point is, one of the key functions of this tool is that when you position it on the skin, it stays put. Now, as with a loop, which has rounded steel, that slips. This will not. So once we get the pressure, or once we get the position of this, we wrap the follicle in the center of the loop, we press down, and then that tool does not move. Then we're able to direct pressure beneath the follicle and have a lifting effect. Therefore, we get everything out of there without concern about leaving some particle behind. So this was a concept I had in mind, and this will make you probably laugh, but where the original idea of that came from were my clients who had described, every kind of primitive device on earth that they've used to try to address skin conditions. And one of them that kept coming up was a hairpin. And I was looking at a hairpin and thinking, what is it about this that is working for them? And what I realized that it was isolating pressure. It had a little bit of a ridge to it. And yeah, you could get something out of the skin. And I thought, well, I wonder if I could find a way to really improve on that and make it a very precise tool. And so dermatology friend of mine gave me one of those tools, Miltex tools. And after ruining about 40 or 50 of them, I came up with a concept that was working the way I wanted. And then I was able to then create the method, because in different parts of the face and on the back, it's used a little bit differently. And this is particularly true at the jawline. And when you're dealing with closed comedones on the jawline, they're virtually impossible to remove. But this tool will do it. If you use it correctly, it'll remove all of that. It's just a breakthrough device, and it still is today.
That's pretty incredible. And I have looking at those images online, you get a sense that it's almost like the end of a traditional umbrella, kind of a hook, and you just wrap it around the skin like that and squeeze and get it out. I mean, of course, there's much more to the technique when you actually do it, and everybody should be, I guess, appropriately trained on doing this.
Oh, Hadar, I wanted to also point out, it's really helpful if you're listening to this podcast, if you look this up, it just makes the conversation so much easier. So for anyone that is listening, you should really check this out. It's the Preston Comedone extractor, and take a look and see how it compares. I wanted to ask a mechanical or maybe engineering related question. I couldn't help it. Douglas, I'm an engineer by background, and I think once an engineer, always an engineer. So I did have a question on this.
Sure.
Now that I'm looking at this design, I think it's really smart because that hook really does curve in. Did you make it a hook instead of a totally blunt end so that you could open up the comedone if you needed to before you push in from under the follicle?
No, it is not a piercing tool. It's not a cutting tool. And this is crucial when we're talking about it being accepted by various state boards of cosmetology. In all the years that this has been in the hands of estheticians, only twice in recent was it challenged by a state board inspector as a piercing tool. Those challenges were successful and nothing happened. But no, it's not a piercing tool. Even though you see that little point there, it never has an effect. The reason that it's designed that way is because of the engineering factor. We needed to taper that end just the way it is so that it could be curved around like that and not break off or have too much edge and not enough point to it. So it's very, very precise. And using that tool, as you mentioned earlier, it really is helpful to get training. And by the way, I have a YouTube channel, which is Preston Acne Pros, that has many, many demos of it on there and instructions for use and so forth. So that's handy for your audience. It is a pressure tool only, but the way that that pressure is applied is key. So you hold that tool like a writing instrument, like you would a pen, so that the tip angles in around the follicle. And that is what allows us to get that great pressure right in that one spot to create the release of the impaction.
Well, fantastic. And since we're talking about innovative ways that you approach facial esthetician services, can you talk a little bit about the approach that you take? What are some other innovations that you have brought in that maybe others should think about? Or is there anything that you've innovated newly over the years, not necessarily tools, but just maybe techniques or approaches and how you might approach the face that you wish other people would know about?
Well, it's an excellent question, and I think it's something that my reputation sort of carries before me. When an esthetician goes to school, get their license, most of them are inculcated in some sort of product culture or equipment culture with manufacturers. In fact, manufacturers are the true educators of our working body. Independent educators almost can't survive. So it's all funded by companies. For them, it's just a marketing expense, right? But it creates a sort of loyalty to their brand, loyalty to their leadership and so forth that many neophytes find, crucial to their success. Once you get past that and you're comfortable on your own, then I began as an individual to challenge a lot of the concepts and givens that were in the industry, because I found that much of what people were being taught was great for the producer, but not necessarily for the well-being of the independent practitioner. We have to make a living. We have to be financially solvent in order to continue. So as an independent, I began to challenge some of these things and really attempted to help the esthetician sort of free themselves from these routines and rituals and so forth that confine them more than gave them broader horizons as practitioners. So I challenge everything and respect what I think is respectable. But, in terms of timing, pricing, a lot of customer psychology. I've spent a lot of time studying customers, interviewing them, finding out what they really value so that we can address that on a personal level rather than just, a rote means of looking at customers one way and, applying our methodology to them. There's a huge divide between what the customer feels and what estheticians feel. And if you don't mind, I'll give you a great example of this. When I'm lecturing at a trade show, and I may have 200 or 300 estheticians in the room, I ask a very simple question. How many of them, before they went to licensing school, went to an esthetician every month and paid for a treatment? And almost no hands ever appear. None. So the question is, we don't have that personal experience with that service. And often in education, the customer's sort of a given. It's like, yeah, here, you've got a customer over here. This is what we're going to do to them, as if they don't have a say, as if they don't have perceptions, as if they don't have preferences. And so I try to help the aesthetic professional understand profoundly who they're working with here and get that information from their client. And by the way, it is almost all emotion, not visual. Customers do not have a visual problem about their skin unless there is a negative emotional reaction to that. And that is, in fact, what we treat. And that is what the motivator is. That's the driver to get people into our treatment room. And so I come at the profession from that perspective. And it's quite unique. You can't sell a piece of equipment to it, but it certainly
Right.
gives people a much, much more profound understanding of who they're working with, and therefore an enhanced relationship and customer satisfaction.
Douglas, this is fascinating because I come from a medical training where the approach is obviously different in our traditions and the way we train. And it never occurred to me that I know, because I know what it is to be my client, because we've all been patients, even as kids, right? We went to see the doctor, got our shots, we got a well visit at the very least, not have, we're sick or end up in the emergency room one way or another. So I think it's really fascinating that you did that. And, to your previous comments, because I think there's a unifying theme here, if I may indulge me for a minute, that, you alluded to in your innovation that a patient comes in and you try to understand what they were using. And just by listening, by carefully listening to your clients way back when, you were able to improve their lives and innovate, and which is cool and exciting in itself for you, for your career, I think everybody likes this concept of coming up with a new thing and then it's successful and wow, gosh darn it, there you are. And it all starts with careful listening. And I think it's true in our field in dermatology, where I always try to tell my trainees, try to really look at the skin carefully. And if you pay attention, not only for this patient, but you can start noticing patterns, which is where innovation comes into play. And it's not surprising then to hear that just by really listening, you came up with a concept of the client psyche and really trying to study it. For those of us who are listening, maybe you can give us a story that will illustrate this, about how listening to the patient's psychology actually changed the actual interaction in the room, maybe the treatment plan even in itself, because I think that helps our listeners to illustrate the point you're making, which I think is a clever one, that it's not always, well, it's almost never what the skin looks like. It's what we think about how the skin looks. Can you give us an example, perhaps?
Yes, I certainly can. And it's one of the key points of some of my training when it comes to customers and the esthetician. I have a client consultation process. This is separate than what we call an intake form that, gives us some idea what their history is like and product use and, and so forth. But these are questions to try to derive from a new aesthetic client exactly what their motivations are and what their expectations are. And there's a few questions that an esthetician could ask, and a physician for that matter, that's just beautiful because it reveals everything. So let's say, for example, I'm interviewing you and I say, okay, wonderful, glad to have you here. I assume, or should I assume, that you've had a professional facial treatment in the past? And the answer is going to be yes or no. But typically it's yes. Maybe a teenage acne client, that may not be so, but although sometimes, they've had unpleasant experiences and they're looking for, for a change. But if it's, let's say, an age management customer, for example, as the majority of people I worked with were, I would say to you, okay, wonderful. Now, have you ever had a facial treatment in the past that you thought, wow, that was wonderful. It was worth the money. I absolutely loved it. Most people say yes. And I would say, okay, tell me what you recall about that. And of course, I have a clipboard in front of me and I'm listening. And here's the thing. In almost every situation where I ask that question, what the client describes are visceral things. It was private. It was quiet. It felt great. It smelled wonderful. I felt so relaxed. I felt cared for. Felt. They never mention the technology, ever. Now, when I ask an esthetician that question...
Fascinating? I think that's fascinating. Douglas, this is such gold conversation. The art of dealing with people.
And so you write these things down, right? Because here's the point. What they remember that they enjoyed is exactly what got them back. Not anything else. They want to experience that again. Okay, so what is that? Those are your marching orders. That tells you what to emphasize. And then everything else comes secondly. When I ask technical people like estheticians that question, they always point to the technical. And this is the breakdown. It's like, no, that is not how they feel. So then if I ask them, have you ever had a treatment you didn't like, and explain that to me, it's very similar. It felt rushed. I didn't feel like the person cared about me. It seemed like, they weren't really that interested in me. Visceral, personal. And sometimes they'll say, maybe the treatment burned or whatever, but usually it's how they were treated. So for me, when I'm approaching an aesthetics customer, these are the key elements that I want to be focused on, and then everything else falls in behind. And I've always thought that a facial treatment is 2/3 personal and 1/3 technical. And that seems to play out really well. And even a neophyte esthetician, if they ask the right questions, can seem like a seasoned veteran.
Oh my gosh, this is such an important point that you're making, Douglas, that I don't know if there's anything more important that we've talked about, at least in this vein. We talk about shared decision making. We talk about how we connect with patients, whether it's lifestyle choices or whether it's, some evidence that we want to bring up over something. But at the end of the day, Hadar, it's really important to know, like, what was their perspective on a visit and what was our perspective on a visit. And it's probably very similar, right? It's going to be how I felt versus we'll say we technically addressed everything that we could have addressed. Or, I think a lot of us are starting to dial in that, hey, how people feel is what makes a difference. Douglas, what's interesting is when you do lectures too, people talk about, I still remember my mentor saying this and it rings in my mind. It was Howard Maybach, actually, Hadar, that said this to me. He said, hey, Roger, you can give the best lecture in the world, but what they're going to walk away with is how you made them feel. And that's what they'll remember of you, not what you told them necessarily.
Yeah, absolutely. I agree wholeheartedly. I think it's such an important part of what we do. And I think to your point, Douglas, about this being two-thirds kind of emotional experience, it is so true, particularly in the area of dermatology, because we deal with the skin. And no person I know has a particular relationship with their liver or their kidneys, right? But they do have a very intimate relationship with their skin. And here they are coming in and trusting their skin in your hands. And there's something about trust, about the emotional experience that they're going through in the treatment room, be it with the esthetician, with the dermatologist, with a plastic surgeon for that matter, that really gives us, we always talk about that relationship in the room where the patient really is vulnerable. But I think when it comes to skin, there's a special vulnerability there that opens this up to a huge opportunity to really speak to the patient on the emotional level. And you put it so nicely, Douglas. I agree with Raja wholeheartedly. I wanted to end with maybe a final thought from your perspective on the way that dermatologists and estheticians can come together in a perfect harmony, if you will, especially when it comes to acne management. I think you alluded to the fact, although you don't look like it, that you've been around for a minute or two. And can you share with us maybe one or two key points that you've noticed in your career when this synergy really works well for the clients and for everybody else involved?
Yes, it's an important question, and quite frankly, one that's been very challenging for me in the years that I've worked in the aesthetics field. Trying to find a dermatologist who, first of all, understands what an esthetician does, takes a real interest in that, and respects the boundaries, if you will. These aren't legal boundaries, except for on our part, of what one professional can offer this patient in managing some aspect of their appearance. For example, I often ask my clients, are you working with a dermatologist? Well, yes, no. What is that experience like for you? Well, they never, they rush me. They never teach me anything. Well, I love hearing that because I'm going to do it, you see. But I also understand something else. And, for some reason, my colleagues seem to have this ongoing, animosity towards dermatologists, and I think it's basically just a reaction formation to to a self-esteem deficit, but that's another question. So we'll just tackle them there. But the thing is that when a person comes to an esthetician, hopefully they can take the time to explain to a customer how, let's say, inflamed acne actually works, provided they know, needless to say. And what I found is that most dermatologists, and I get this, don't have the time to do it, particularly if you're talking about teenage acne and here, and they got a blue card in their hand, right? There's no money in that. And therefore, volume, and I've talked to some dermatologists who said, my God, I had to see 20 patients an hour to make it pay. And, how do you do that, right? So the time isn't there unless you're doing, concierge service and you can charge, $400 or $500, pay up front for that visit. I can take the time to do that. Said, look, your dermatologist is trying to address something for you, but let me explain actually how this works. Let me tell you about how the acne cycle forms. I show them some diagrams. I explain it. And they're so grateful for that because they're like, wow. And it also builds a great deal of trust in me that I would take the time to do that. Now, when it comes to interfacing with a dermatologist, I just haven't had any luck with it. And I really wish I had. But 9 times out of 10, the dermatologist, I was always an independent practitioner, but the dermatologist would either bring in an esthetician from the outside, so it was going to be a one-way door, or they would, in many cases, try to sell them cosmetic services, which would offend them because I sent them in for something specific, or they just simply would, in some cases, countermand my own product treatment suggestions because they had a line of their own. And this happened, I'm in Silicon Valley. This happened again and again and again and again, and I just had to stop. But it always was tough for me because I really could. I was always looking for a new, a brand new neophyte dermatologist because, boy, could I have helped that person build their practice. But, it just never happened.
Yes.
So it was always a disappointment for me.
Well, I think if you are out there, an esthetician, and have been disappointed, or maybe a dermatologist, and have been trying to cultivate a relationship and find it challenging or barriers, well, here's a solution for you. And Douglas, I think you're going to like this one. This is called the Integrative Dermatology Symposium. This is our meeting where we also introduced the Integrative Aesthetics track. This is happening pretty soon in September, starting September 26th through the 29th. And this is happening in Arlington, Texas. And not only will you learn a great deal about dermatology and integrative medicine and the intersection of both of those, you will also get to meet some estheticians, maybe in your neck of the woods, and you can learn how to mitigate those challenges and really see the potential in collaboration because you are absolutely right, Douglas. Undermanaged care, dermatologists may not find the time to do this crucial education about skincare in general, which I think is something that a lot of our patients really, really want. And so finding the right relationship with an esthetician, either in-house or outside, that you can collaborate in a respectful way sounds like a promising recipe for success. So with that, I want to thank you, Douglas, for your expertise. And I really look forward for your presentation there at the IDS, because I know everybody is really interested in learning about the simple things, how we can always innovate around them, as you explained so eloquently. So I will see you personally over there. I hope everybody who's listening will join us in Arlington, Texas, which is right in Dallas, on September 26th. Thank you, Douglas, for your time and for your expertise.
It's been a pleasure. Thank you for having me.
And that's a wrap for today's episode. But these conversations are just way too good to end here. Wouldn't you agree, Raja?
Absolutely, Hadar. That's one of the main reasons I get so excited about our conference, the Integrative Dermatology Symposium. Every year, it's a chance for us to continue expanding our minds for what's possible in dermatology for our patients, and also to bring the latest clinical knowledge back to the clinic. And this year's theme has been long awaited. Do you want to spill the beans?
Oh, yes. You don't want to miss this one, folks. This year's theme is Nurturing Skin Resilience, the Science of Aging and Wellness. And it's happening from September 26th to the 29th, 2024.
Yes, and we'll cover topics from conventional medicine to traditional approaches, from inflammaging to exosomes, and from cosmeceuticals to women's health and more.
The agenda lineup looks amazing. Not only the topics, but also the real-world case discussions, workshops, and networking events. No wonder we've expanded the IDS to 4 days. So much more to learn and do.
Plus, you can't go wrong at a brand new resort that just opened up this year at the Lowe's Arlington Hotel and Convention Center in Arlington, Texas.
Texas, here we come! And for our esthetician colleagues, please join us on Sunday for the Integrative Aesthetics track.
So come check out integrativedermatologysymposium.com for all the details. We hope to see you there.